Tonight, we are getting a more detailed look at who's affected by COVID-19 cases in our area, including for the first time, a demographic breakdown of cases in Cuyahoga County, the county with the most cases in Ohio.
5 on your side, investigator Scott Knoll learned health officials say it still may only be part of the picture.
There's been a lot of talk lately about COVID-19's impact on minority communities, including African Americans. A newly released CDC report this week shows blacks make up a disproportionate number of patients treated in the hospital for the virus nationwide. But here in Cuyahoga County, health department numbers paint a different picture with a catch. This map shows a breakdown of Cuyahoga County's COVID-19 cases by zip code. The darkest green areas, each with 25 or more confirmed cases. To the west, only North Royalton. But to the east, health department numbers show areas around University Circle and inner ring suburbs like South Euclid, Shaker Heights, Cleveland Heights, Garfield Heights, Bedford, Bedford Heights, Maple Heights, and Beechwood, all hard hit. An analysis of more than 1,000 cases by the Cuyahoga County Board of Health found 44% of those cases in white patients, 39% black patients, 7% of COVID-19 cases other races, with another 10% race unknown. Compare that to U.S. Census figures showing Cuyahoga County's makeup is 64% white, 31% black. But, warns the county's medical director,
we are limited in our testing, which has really big implications, profound implications for understanding the true prevalence or the true amount of infection in our community.
Dr. Heidi Gullett, quick to point out limited testing means it's been largely limited to patients in hospitals, first responders, and healthcare workers. The health department says that likely means many who need testing aren't getting it and aren't being counted.
You can't go to a drive-in testing site if you don't have a car. So, and if those locations aren't accessible to people, that also puts up a barrier to some people to be able to access testing.
Especially troubling because health officials say the county has a long documented racial disparity in rates of chronic disease, which make patients more susceptible to complications from coronavirus.
They're at a higher risk because of those challenges that they face that are compounded by poverty.
It's why the Board of Health says getting more testing and getting into the county's lower income neighborhoods remains a priority, not only to get a more complete picture of COVID-19's spread, but to potentially save lives.
I feel that a lot of people in our community who need testing haven't accessed it, and that includes people across lots of different races and ethnicities. But I am really concerned about people who don't have access to transportation and who don't have access to primary care providers who are able to order the test.
The county says it's still working on putting together an ethnic breakdown of COVID-19 cases, as well as analyzing race and ethnicity of people who died of the virus here. In Parma, I'm 5 on your side investigator Scott Knoll.